Good afternoon. My name's Helen Collis. I'm a senior healthcare journalist with Politico, and next we'll be joined by 4 MEPs to scrutinise the work of the European institutions in health policy as this mandate draws to a close. And, of course, discuss what Europe needs to focus on next in its 5-year mandate that will begin later next year. It's fair to say that this current mandate has been unprecedented for European health legislation and involvement. The pandemic triggered a huge healthcare budget amounting to 5.4 billion euros and set in motion the first steps delivering what the Commission described as a European health union. Initially, this included the expanded mandates of the European Medicines Agency, as well as the European Centre for Disease Prevention and Control. It created HERA, the European Health Emergency Preparedness and Response Authority, and a new regulation on serious cross-border threats to health. But the funding goes beyond these bodies to support regional and national health programmes. In cancer, the first specialist network has been set up as part of the Beating Cancer Plan, and in medicines, the Commission is aiming for every citizen to have access to the latest drugs through the revision of the pharmaceutical legislation. There is also the ambitious European health data space legislation to regulate sensitive health data. We'll be discussing these policy files and more shortly, but before we start, a few housekeeping remarks. You can ask questions through the Swap Card platform by scanning the QR code, and if you're joining us online, you can do so on our event webpage. If you hear something you'd like to share online, our hashtag is Politico Healthcare. So, joining us for this panel, we have a stellar lineup of MPs, online and on the stage, who have either been rapporteurs or continue to be rapporteurs, shadow rapporteurs on health policy files, and regularly speak up in committee meetings. So joining us online, we have Stelios Kimpouropoulos, MEP from Greece with the European People's Party Group, also of the Sant subcommittee and the COVI committee. On my left, we have Sarah Sedas, an MEP from Portugal with the Socialists and Democrats Group, member of Envy Committee, the Sant subcommittee, and was also on the special COVI committee as well. To her left, we have Susana Solis Perez, MEP from Spain with the Renew Group and a member of the Sant subcommittee. And finally, Katarina Konečná, an MEP with the Czech Republic, from the Czech Republic with the Left Group and also a member of Sant and COVI. So, we know this has been a pivotal mandate for the European institutions in terms of healthcare legislation and initiatives, from the purchase of COVID vaccines to the EU for Health Plan, the Mental Health Initiative, and more. Sarah, I'll start with you. Did you ever think that Europe would step so far into healthcare? And what, in your view, has been the biggest achievement from this past mandate, which is obviously still going, and what's had the biggest effect across the board for citizens' health?
That's a great question. Good afternoon, everyone, and thank you very much for having me here in such a lovely panel. It's nice to discuss with colleagues and with you what we are doing in the European Parliament when it comes to advancing health policy within the EU. I would never imagine that we would go through this mandate. I don't think anyone imagined through the biggest pandemic of the last 100 years, which highlighted the true importance that health has in our lives, which goes far beyond just the disease, which connects with many different sectors, and we've seen that. And huge achievements were done in the part of health that we can actually work on, which is protection of public health, is a shared competence between member states and the EU, and that's where we mainly focus on. We have the EU for Health program, which has the example of a huge budget, 10 times more than what was originally proposed, and that was due to importance on strengthening our health systems, to addressing health determinants across different policies and sectors, and that has been quite remarkable. I think the main achievement that we managed to get this mandate was the building of the European Health Union, and that has been done through the EU for Health, as you stated, the Serious Cross-Border Health Threats Regulation and increased mandates of ECDC, EMA, establishment of HERA, the joint procurement, which opened the door for us for this new pharma revision and yesterday's communication by the Commission. Mental health, NCDs, cancer, a lot of focus on different diseases, but also a lot of focus on the determinants. And this is where we can actually have some power, the European Parliament, together with the Council, which is legislating on the non-risk factors for many diseases in order to increase health well-being for our populations.
Lots of things to dig into there. Stelios, I'd like to bring you in next. From your perspective, looking back on this mandate in the future, which piece of legislation or work do you think will really stand the test of time? Is there one change that will have a greater legacy than others?
First of all, I would like to thank Politico for this conversation. And I think that is very timely and very important to raise the issue of health on a European level. Definitely, as Sarah said, the pandemic, COVID-19 pandemic, played a pivotal role during this mandate, and I think, and everybody can accept this and can agree that play a very catalyst role to develop and to start talking more and more among member states, but not only, but also in Commission and Council and European Parliament, to talk about how we can build a better and more sustainable and better prepared European Health Union. So we have done we have created the starting point, and now we try to build on this basis. I think during the last previous years we had very good reports, but not only reports. We have strategies, we have plans, and we have created something in common in order to create a better collaboration between member states. We tried we had a better funding, and this is the basis. We have the report of Becca, a very important final report to understand and to realize that only if we are united we can fight cancer. We had the European Care Strategy, a very important file that as a result, it shows that we need to create something in common in order to protect the person who create the caring for people who are more vulnerable. We have the COVID committee. We had the health technology assessment regulation. There are some other ongoing initiatives like SOHO, EHDS, the rebuilding of EMA through the pharmaceutical directive. As I mentioned before, the mental health report, which is going to be voted on November 7th. So we create something, and through the collaboration, not only between member states, but also the political groups, that I believe we have something in common and we can sit on the same table and discuss. We need to continue on the next mandate to create something for health. Yes, we know that the health is national competence, but we still can create the collaboration between different parts of Europe and especially different member states.
Thank you, Stelios. Susanna, we've heard then that a better collaboration could really be a big legacy of the last, or this mandate. I want to ask you if the Commission went far enough. Stelios talked about the pandemic being a catalyst for this big movement in health policy we've had in Europe. Did the European Commission grab hold of this opportunity enough, and was it ambitious enough in its plans?
Thank you very much. It's a pleasure to share this panel with my colleagues. And first of all, what you will see today is that when we talk about health, there is a big consensus among political groups, which is very good, and I hope we will keep it when we discuss the pharma package. But now it's a pleasure to work on mental health with Sarah, with Stelios. There is a very good collaboration, and this is great within the European Parliament. Responding to your question, I agree with what has been said here. What we have achieved at the European level is great. We have never thought that we should have such improvements, no, in building the European Health Union. But as you mentioned, we have to keep this momentum, and this is important because now we still have to tackle a lot of problems. First, we cannot have this two-speed Europe where there are some patients in Europe who has access to an innovative product and other no. For example, there is in some countries there are in 3 months you can get an innovative treatment. In other countries, 2 years. And so we have to address that type of things. Shortages, it's also something that it is urgent the Commission come up with a solution. It's true that yesterday they announced the communication, but we insist, and we had a debate 2 weeks ago in the plenary, that it is not enough with mitigating this problem. It is about structural changes that we need to do at European level, and that has to do with our strategic autonomy, also on health. And this is important that we are more ambitious. Where we have the huge opportunity is with the pharma legislation. And for me, and I think all of us, we are very disappointed that we cannot finish this important legislation, which is critical for Europe, not only for the patients, but also for our competitiveness. It is very disappointed that we will not be able to have this position. But as I mentioned, I think we have a problem of autonomy, and we should address it. We should address the shortages. Although it has not been finished, we have a huge, a big potential with the European Health Data Space. It could make the difference in Europe. We can imagine to have a European Union of data, where we have a free data. Once it is safe and with all the data protection, we can have data available for research, for innovation, but also for our citizens, which will have will mean an improvement in the health systems, because it will give us more access to data and improvements in our member states. So many things have been done. I think we can be proud, and we have to work together with regional and with national authorities, because it's not only a national competence. In 19 of the 27 member states, it is a regional competence even. So working together, this is the main goal.
Loads of goals there to try to reach. One of the things you just mentioned was that we have to keep momentum. Katarina, one of the challenges will be keeping that political relevance of healthcare in the member states and in Parliament and in the EU institutions, especially as elections around the corner, the rise of conflicts and security concerns is growing by the day. And it was notable how little healthcare was mentioned in Ursula von der Leyen's last State of the Union speech. How can we maintain in Europe this momentum in healthcare policy and really make sure that it doesn't start to wane?
So from my side, thank you very much for your invitation for this very nice panel, and thank you very much for the opportunity to speak here. So I maybe will be remembered because if we work on 2017 in Access to Medicine, which was a report, where we speak about medicine shortages, joint procurement, all these things. And in the other side, from Commission, from member states, we heard just, yes, it's maybe just as your dreams. After COVID, everything changed. I think that we had good work in the European Parliament, but I need to tell you that it was because the European Parliament pushing these topics, because in many times we discussed with the Madam Commissioner and with the Commission that it's necessary to do it something. and now we are where we are. I think that we just are in a beginning. Because, yes, we speak about the European health data space, we will speak maybe about the pharma package, we show yesterday communication from Commission about the medicine shortages, but there is just huge work for our colleagues for next mandate. Mm-hmm. It's necessary to do it, and I think that the very, very important thing is the communication with the member states. Mm-hmm. Because we could prepare what we want. But if member states and especially Minister for Health from member states not take it, it's maybe many our things stay as dreams. Mm-hmm. And I think it's bad. We'll see what's happened. Really, if I remember in the last 5 years, in my first 5 years from 2014 to 2019, about on health issue were just maybe five colleagues. We were really small groups as a family. Yeah? Now everybody understands the health issue because the COVID, because the many files. But I think that the huge work is before us.
And in order to keep that momentum up, and there are a huge number of files and a lot of work to be done, one of the big questions that remains is how big the healthcare budget will be for the next mandate. Sandra Galina, head of DG Santé, has said that the failure of public health bodies and NGOs to effectively demonstrate that the cash handouts that they've received over this mandate have really improved health outcomes is likely to have an impact on the amount of the next budget. If they can't spend it wisely, they won't get so much. Sarah, do you think that some public health bodies have become too complacent? Have they been leaning too much on European funding?
I think the paradigm shift during this mandate, and let me just go back a bit on what Katarina stated and her reflection that we need to get health ministers on board. And it refers to your question. I truly believe, yes, we need health ministers on board, but also finance ministers. And to clearly demonstrate that health or improving health is a cost beneficial. It's very cost beneficial, and that's what we're talking about. In many of all these regulations, we're looking at the disease, but we're also looking at improving health of the populations. On funding, it's always the problem. Everybody wants it. It's important to understand that there's certain guidelines that need to be followed, but I believe that the EU4Health program gives a lot of margin of maneuver to reach the different, the 4 big goals plus the 10 more specific objectives. Okay. So, yeah.
Okay, and Stelios, I wanted to find out what your thoughts were on how local organisations have handled this extra money. Are you concerned that any fall in budget, which is what we're all anticipating, could really hit these bodies hard?
I think that we need this more funding in order to have a better result, but. On the other hand, I believe that we have the opportunity through the organizations that you referred to in the local level to support the health system. But on my view, it's not only the problem is not only on funding. Yes, it is needed to increase the funding, but also we need to create harmonized of standard between member states in order to understand how the different national health system works. We need to create, as Juliana said, a better coordination and information, exchange information. We started this panel talking about how digital technology can assess on the issue of health. We need more research and innovation, and this is where the funding needs to go. We need to use resources, and we need to have to show that if we want the innovation, it can be this innovation on European level. It's not need to take the innovation from other countries. Therefore, it is time, and it's a very unique opportunity through the revision of pharmaceutical directive and regulation to show that it's possible to have innovation on a European level. We need to build up this, and we need to show that it's time, if we have a stable legislative environment, everybody can invest on Europe. So the only opportunity to create jobs, to create a better health system, is to create a very constructive, a very stable legislative environment. And this is the time, this is the momentum.
Mm-hmm. And sticking with you, Stelios, in order to do that, you represent on our panel someone from the biggest party in Parliament, party grouping. Are there any discussions at the moment on what budget it will be campaigning for health in the next mandate? Or are we too early to discuss that?
Sorry, I didn't hear you.
Are you able to tell us from the party's position what kind of healthcare budget you will be pushing for in the next mandate?
I don't have a specific number, but definitely it is needed to raise it. It is needed to give the opportunity to small medium enterprises to show that it's time for Europe to flourish. And I think that we can make it, and we need, as you said, more money. It's not only the number behind the euro, but also is how we are going to address this money and where we are going to address them.
Mm-hmm, mm-hmm. In a recent committee of the regions meeting a few weeks ago, I was watching, and city mayors and local leaders were really supportive of the EU's work in the pandemic, and they were really thankful for the expansion of Europe's healthcare remit. Some people even said that they were, previous to the pandemic, not supportive of Europe doing so much in health policy, but now they would really encourage and welcome even more European involvement. Susanna, based on this, do you think Europe is limited in what it can do in healthcare by the treaties? And is this enough information to support potentially even a discussion around changing those treaties?
I think we have proved that it's not needed to change the treaties, and we can have much more done at EU level without changing it. I was with the Committee of the Regions, and they were very happy to collaborate more with the European Union. More can be done. It is true that the budget is at regional or national level. 40% of the budget is only health at regional level. So at this point, there is not much to do at EU level, but indeed, as Stelios mentioned, we can work on harmonizing, on coordinating, on unifying our efforts in order to give a better support to the regions and to the member states. In this regard, at European level, much more can be done. For example, when we talk about shortages, it is something that is suffered by all the European countries. In Spain, 1,000 drugs are in short supply. So in this term, we can work together. And for example, we could have more autonomy, or we could work in the same way that we work on some dependencies like chips or critical raw materials. Why not a Medicines Act? That's something that we are pushing the Commission to come up with such a solution, where we know it is not protectionism, but to know where we should reduce our dependencies, and this is a way we can also help member states and countries and regions to deal with this. And in the same way with the pharma package, no? There are things that can be solved at European level. There are things that should be solved at member state level. For example, we need to review the transparency directive. It is critical and this is something that should be done at a member state level.
Thank you. I'm conscious of time, and I'd really like to hear from all of you where you think the priorities should be in the next mandate for healthcare. Obviously, it will be, and a large part of it will be dictated by the funding that is awarded in the end. Katarina, I'd like to start with you on where you think the biggest priorities need to be. We've obviously got some big health policy files which won't be completed this mandate. But beyond those, if you had to choose one or two areas, we've heard this morning some really interesting debates around AI in healthcare and climate and health. And I'm just wondering from each of you where you think the priorities should be set.
So everything starting with the money. Yes, that means that if we find more money with the next MFF, I think it will be great. But from my side, I don't believe it. But I will do it everything which is in my hands that it's come. But in the other side, if we find more money, it's impossible to spend this money for new agency, for example. Because I really think that the HERA is something which take it huge money, and I asking why. Yeah, because we have ECDC, we have EMA, we have many agencies, and I asking why we need to establish new HERA, which spend, I don't know how huge budget. That means that if we find more money, we need to find this more money, especially for screening, for joint procurement of innovation drug and drugs for rare diseases, or the fight for mental health. I think this is for my four most important things. And in the other side, as we read yesterday evening in the Commission communications, Critical Medical Act is something which coming, and we need to be preparing for this. But I'm afraid a little bit that without changes the primary treaty, in principle, is impossible. Very open.
And can you expand on that and why you think that's not possible? Susanna said it is demonstrated that we don't need to change the treaties to really do this kind of work.
Yeah, I understand, because Susanna is from the group which does not want to change the treaties. But in the other side, if we speak, but not very correctly, but if we speak that we want to give more power to health issue, we want to give more power to, for example, or we want to discussing about the joint procurement, about the medicine shortages, about the Critical Medical Act, without changes the treaty. It will be just that we coming with something and member state do it or not. And this reality, I'm so sorry if I saw back the HTA, the all these file, every time stop it or end it in a member state, and it was impossible to doing something more important, so for all patients in the European Union, for example. Because if some country, I don't know, okay, I'm from Czech Republic, it wasn't problem in Czech Republic, but if I take it to Czech Republic, if Czech Republic don't want to do, nobody will push it from this side. Yeah.
And so it feels like a pretty critical time for health policies, a critical time for many things, health workforce, as we heard earlier, infectious diseases, climate change, the really fast development of AI and trying to keep up and make sure that that's safe. Would the next mandate really be the time, in your view, that we have to really look at these treaties then, if we're going to get ahead and really make a bigger impact in health policy in Europe?
Yes, from my side, it's necessary, and as I told you, yeah, it's without change the treaties, without we give it the health issue for most common policy. I think it's impossible to find solution on most things about what we know that's still existing and will be existing after pharma package, after European health data space. Everywhere there, it's for member state many possibilities how want to work with it. And I think that if we now find a way, and from my side, is sovereignty of the member states the most important. But in the other side, if we're discussing, for example, about some new pandemic which could come, and we want to be prepared, and I hope that we all want to be prepared, without better cooperation between member states and maybe better cooperation with the Commission and the European Parliament, it will be impossible.
Sarah, where do you sit on this debate? I'd like to hear what first of all, what you think the priorities should be for the next health mandate, and whether or not that would involve any kind of change to the treaties to get those things done. Screening, joint procurement, rare diseases, mental health, Critical Medicines Act are just 5 of the things that Katarina's listed. Where do you sit on these things?
Yeah, I think for the next mandate we need to go more in depth into the European Health Union. And I truly believe it's not if we're going to the next pandemic, it's when is the next pandemic coming. We're going through the climate emergency, and that is a health emergency. And that's a lot of different changes are going, demographic change in the EU. That means people live longer with more comorbidities, more usage of services. All these things need to be taken into account. So obviously have a good preparedness part within the European Health Union, but also focus on prevention. We know so many risk factors that cause many of burden of disease that are connected with increase in DALIs in the EU, and this is something where we can act, and we don't need to change treaties. We have that power. We can act on substances that are harmful for us, for instance, glyphosate, on agriculture, pesticides, but also on tobacco, alcohol, sugar, fat, and so on. So there's many things that we can do, and I'm not trying to just pinpoint one, because, for instance, when we talk about cancer, 10% of cancers are caused by pollution. Big part of the pollution comes from air pollution. Then why didn't we got everyone on board when it was to improve the air quality directive? So I think we need to be very pragmatic on what's making us sick. And I think that should be one of the goals for health in the next mandate. But I'm also a medical doctor in public health, so of course I'm going to advocate for better prevention and health promotion. In regards to the treaties, I think we still have so much things that we can do with the current treaties. Because when I started, everybody was asking, what is a medical doctor doing there? What are you doing there? There's no health policy in the EU. And this mandate, with the colleagues, we managed to show them wrong. And we actually achieved a lot. And one of the most incredible things we managed to do at the EU level was the joint procurement for vaccines that managed for us to recover from the pandemic or turn the page on the pandemic so fast. Otherwise, it would be very unequal. So we also, and that leads me to the third part, which is addressing inequities within the EU. And that can be done at EU level, member states level, but also regional and local level. We need also a bottom-up approach and not only a top-down approach.
And how is this going to be delivered by the next DG Sante or DG whatever it's going to be? One civil society group told me that it shouldn't be focusing on health and food safety, but health and food, because the food we eat has such an integral impact on our health. Others have suggested we need a commissioner for well-being, broadening out the scope of Europe's involvement in factors beyond that impact our poor physical and mental health. I'm just trying to look into the future, into what the next DG Sante should look like if we're really going to push into air pollution and climate change and digital health. How should it best be structured?
Very quickly, because I can see the time is running. If we have a health in all policies approach, if we have a health commissioner, but a health in all policies approach within the Commission, we don't need to change DG Saten's, but we need to change is what they work on. But I don't like to talk that much on the Commission from the Parliament side. What I think we need a standalone committee on health and well-being, if we can.
And Susanna?
Yeah, I agree with Sarah. I think much can be done without changing the treaties. We have demonstrated that with the COVID vaccines, with the COVID certificate, things that were unthinkable years ago has been done this only in 3 years. So we should build on the European Health Union. And as I mentioned, and it has been mentioned, prevention is critical. 40% of the cancers can be prevented, so we should work on it. And then we need a new, modernized framework. We need this pharma package in order to have better access to medicines. And also, without forget that we need Europe to flourish in innovation, and we need to make Europe the best place to innovate, because we have one of the most important industries, which is the biotechnological industry here in Europe, and it is also our commitment to make sure that that we are competitive also in this sector.
Just short, if you're asking about the DG Sante, it's fine, but I will be very happy if in European Parliament will be established a Sant committee. I think that it's something what we really needed. Sarah agree, I hope, with me.
No,
because
I do. I think we all agree here.
We work on all health issue, and it's really many issue, and we have no time. We need to discuss more with the stakeholders, with the patients, and it's no time in ENVI committee now, and I think it's a little bit tricky, and we need to doing change as a member of the parliament for our future colleagues, that it's necessary to do it. I understand why ENVI don't want to give us, but in the other side, the health issue is now in the another level than it was before, for example, 5 years.
Very quickly, that everybody can agree that if we want to see a strong European Health Union, it can be started from us, from European Parliament, with a standalone health committee, maybe with food security. But yes, we need to start from this point, from European Parliament, from the people. This is my belief. And I think very quickly that on this game of creating and going into the future on the next mandate, we need to use the digital technology and AI as a very good tool in our hands. But we need to have this technology with a human standard orientation. This is something that we need to see, to understand, and to create this tool which will be controlled and will be led by humans. So this is something that we need to fight for, and to understand better how technology can help us in early the better diagnosis, in prevention. Everybody said before in panel that we need a better prevention. Yes, we can do it through AI. And to finish, health in my group is priority as a whole. We don't have specific issues. Yes, let's say for me it's rare disease, but as a whole, as a EPP group, the health is a total priority for the next mandate.
Thank you so much. That's all we've got time for. I want to have a big thank you to all of our MEPs for joining us today. I know you're under a lot of pressure at the moment, so we do appreciate it. Next up, we have our final headline interview with Health Commissioner Stella Kyriakides, moderated by Carlo Martuscelli, where perhaps she can answer some of these outstanding questions. Thank you.